So the major area of concern related to patient safety that we will be discussing is PPE, which stands for Personal Protective Equipment. So to start the presentation off, I'm going to give some background information on PPE. According to the Occupational Safety and Health Administration, PPE is equipment worn to minimize exposure to hazards that cause serious workplace injuries and illnesses. There are a lot of different types of PPE, including eye and face protection, hand protection, body protection, respiratory protection, and hearing protection. These categories are broken down even further into specific types. There are a lot, so I'm just going to focus on a few that are being used a lot in hospitals during this pandemic. I spoke with my friend who is currently working at Mercy Hospital in St. Louis, and she told me that on non-COVID floors, they are wearing surgical masks and latex gloves with every patient. Then on COVID floors, they are wearing disposable gowns, N95 masks, a surgical mask over the N95 mask, a face shield, and latex gloves. On the right side of the slide, I included some images to see the differences. The top image, the blue mask, is what is known as a surgical mask, and the bottom image, the white mask, is what is known as the N95 mask. PPE can be used in multiple settings, but obviously for this presentation, we're focusing on healthcare systems. So the general benefit of PPE is that it can reduce the transfer of viruses, but specifically, it reduces the transfer of viruses from patients that are infected with COVID-19 to employees, and then it can reduce transfer from employees who have been in contact with COVID-19 patients when they are working with patients that do not have COVID-19.